Tricuspid insufficiency is a condition where blood flows backward from the right ventricle to the right atrium due to a dysfunctional tricuspid valve. It can be caused by various factors and has important implications for patient care. Echocardiography is commonly used to assess the severity of tricuspid regurgitation. It provides valuable information, but has limitations in accurately measuring certain cases. The clinical implications of different degrees of severity are still being researched and debated. Secondary tricuspid regurgitation occurs in left-sided heart disease, leading to increased pulmonary artery pressures. This is caused by right ventricular dilation and dysfunction, resulting in tricuspid valve abnormalities. Addressing the underlying disease and optimizing right heart function can improve outcomes. Tricuspid regurgitation can be present at birth or develop later in life due to congenital heart defects. Anatomical variations, such as Ebstein's anomaly, are characterized by abnormal positioning and malformation of the tricuspid valve leaflets, leading to regurgitation. Systemic conditions, including Marfan syndrome and rheumatic heart disease, can also contribute to tricuspid regurgitation development. Management strategies for congenital tricuspid regurgitation depend on the underlying defect and may involve surgical repair or replacement of the tricuspid valve, as well as addressing associated cardiac abnormalities. In select cases of tricuspid regurgitation, primary repair of the tricuspid valve may be feasible and offer favorable outcomes compared to valve replacement. Surgical techniques for tricuspid valve repair include annuloplasty, leaflet repair, chordal reconstruction, and commissuroplasty. These procedures aim to restore normal valve function and prevent further regurgitation. Long-term durability of tricuspid valve repair is influenced by several factors, including patient characteristics, underlying pathology, and surgical expertise. Regular follow-up and monitoring are essential to assess the effectiveness and longevity of the repair, as recurrent regurgitation may necessitate further intervention. Tricuspid valve annuloplasty repairs the fibrous ring supporting the valve leaflets. Different methods, such as flexible or rigid ring placement, correct tricuspid regurgitation. Proper sizing and factors like annular dilatation affect outcomes. Evaluation determines the best approach for improvement in symptoms, mortality, and recurrence. Transcatheter interventions have emerged as a less invasive alternative to surgical treatment for tricuspid regurgitation. These procedures involve the deployment of devices, such as transcatheter tricuspid valve repair systems or transcatheter valve replacements, via percutaneous access. Patient selection and procedural considerations, including anatomical suitability, device selection, and operator experience, are critical for procedural success and patient outcomes. Long-term data on the effectiveness and durability of transcatheter interventions are still evolving, and ongoing research aims to refine patient selection criteria and optimize procedural techniques. Tricuspid regurgitation frequently coexists with left-sided heart disease, such as mitral valve disease or left ventricular dysfunction. The mechanisms behind this association involve hemodynamic alterations, ventricular remodeling, and tricuspid valve annular dilation. The presence of tricuspid regurgitation in these patients carries prognostic significance and impacts treatment decisions. Management strategies may involve addressing the underlying left-sided pathology, optimizing medical therapy, and considering tricuspid valve repair or replacement if warranted. Infective endocarditis is a dangerous infection of the heart valves, and the tricuspid valve is often affected. Staphylococcus aureus is the main bacteria involved. Diagnosis requires careful assessment and evidence from tests. Treatment involves medications, draining abscesses, and possibly surgery. Tricuspid regurgitation has been found to be associated with atrial fibrillation or atrial flutter, which are common cardiac arrhythmias. The mechanisms underlying this association involve hemodynamic changes, atrial stretch, and atrial electrophysiological remodeling. Importantly, the presence of significant tricuspid regurgitation may influence the management and treatment strategies for atrial fibrillation/flutter. Anticoagulation, rhythm control, and optimization of volume status are critical aspects of managing these intertwined conditions to improve outcomes and prevent further complications. While surgical and transcatheter interventions form the mainstay of treatment for tricuspid regurgitation, medical therapy can play a supportive role in managing symptoms and underlying conditions. Pharmacological agents, such as diuretics and vasodilators, aim to improve volume overload and reduce right heart pressures. The mechanisms of action vary among different medications, and their efficacy in tricuspid regurgitation management is evaluated based on symptomatic relief, hemodynamic improvement, and impact on overall patient outcomes. The decision between tricuspid valve repair and replacement depends on various factors, including valve pathology, comorbidities, and patient characteristics. Valve repair is preferred when feasible, as it preserves the native valve apparatus and reduces the risk of long-term complications. Operative strategies for tricuspid valve repair involve the utilization of various techniques, as mentioned earlier, to address specific valve abnormalities. Clinical outcomes following tricuspid valve surgery are influenced by procedural success, patient factors, and adherence to postoperative care. Long-term follow-up is crucial to monitor valve function and durability. Tricuspid regurgitation is associated with varying degrees of disease progression and impact on patient outcomes. Prognostic factors, such as regurgitation severity, right ventricular function, pulmonary hypertension, and comorbidities, can help identify patients at higher risk of adverse outcomes. Understanding these predictors guides clinical decision-making, including the timing and necessity of intervention. Long-term outcomes rely on appropriate management strategies and continuous monitoring to detect disease progression or recurrence of tricuspid regurgitation. To summarize, tricuspid regurgitation is a complex condition with various causes and consequences. Its evaluation, treatment, and impact on patients' health require a multidisciplinary approach and ongoing research for better management and outcomes.